answering your questions that you had after I did my little anatomy lesson the other day. If you missed it, I saved the videos in a highlight called Anatomy. So go watch those and then come watch my answers to some of these follow-up questions. So this one is asking if someone had a history of POP and they had a subsequent pregnancy and delivery. There's like a little bit more to this question, but would I recommend using a pessary in the early stages of the postpartum healing? Absolutely. Absolutely, and I hope that more doctors are moving this way to early prescription of a pessary. So as long as there's any tearing that's healed and things like that, then you're okay to wear a pessary. This is something that the women's bladder doctor, Dr. Sarah Boyles, and I talked about in our live. That is in my pessary highlight if you wanted to watch that. So yeah, absolutely, I would get a pessary early on after a next delivery. I can't necessarily make recommendations like this. I have a ton of information on pessaries in my pessary highlight that I think would be really helpful for you. If you're in the US, some physical therapists are fitting pessaries, but right now that specialty is really for urogynecologists, so I'd suggest finding one, and it might take a few attempts for you to find the right size and the right type. We've done a couple polls where people asked, like, how many tries did it take you to find the right pessary? And for some people it was like 3 or 4. But they kept pursuing, and they were really happy when they finally found one that worked well for them. It might, and it might not. It depends. That's a answer. If it's a complete one, it's not likely. A partial avulsion can heal, or the muscles and tissues that have kind of pulled away from the bone, they can reattach, or the other muscles will hypertrophy, meaning get bigger and kind of fill in that space. Full ones are much less likely to heal. And there is not a ton that we can do for these. I have a highlight on avulsions as well. There are very few doctors who are actually doing the surgical interventions to fix them. One of the big problems is that they're not caught right away. It's not really evaluated for early on. They're hard to find early on. And by the time they're actually found, the muscle has retracted to a point where it can't be reattached. Yep, pretty much the same. So, a little bit different, but pretty much the same. So, there's no voluntary pelvic floor muscle between the rectum and the vagina. There's muscles underneath it, and there's the perineum between. So if someone has perineal insufficiency, meaning that part of their perineum has really torn and wasn't sutured correctly, properly together, or just multiple deliveries has made that tissue thinner, not as strong, then any forward movement of the rectum is more likely to come out of the vaginal canal because the perineum isn't there to support it. I can go over this later. I'm just going to walk into work and I can show you on the model. So rectoceles are usually lower than a cystocele is, and so it's closer to the opening. So if you don't have that perineal support, it can be a higher grade. Nope, you definitely do not need a pessary. If you are still having a lot of symptoms, and that's really bothersome to you, a pessary is a great tool to help reduce your symptoms, but do not get a pessary just in the hopes that you're going to reduce your grade. The percentage of people who reduce their grade is much less than those who reduce their symptoms and become asymptomatic, and that's ultimately our goal, right? So if you're still bothered by your symptoms and you want to get a pessary, and your hope is that you will allow those tissues to kind of heal and those ligaments will not be stressed and strained as much, I think that's a great option. But if you're asymptomatic already, you're not doing super intense exercising where you're putting a lot of stress down on your pelvic floor, it might not be necessary. This is really a conversation for you and your provider, or just you and yourself. I'm going to say a few more things on that. Just another note on this one, if you are asymptomatic, but you are doing CrossFit, you're going on really long runs, maybe you want to get pregnant again and you just want to support your tissues proactively, I think a pessary is a great option in that case. Again, I view them as like a sports bra, right? Things kind of sag and shift and move as we get older, and gravity's our worst enemy as women, right? For multiple reasons. And why not have a pessary just as a tool if you need it, right?